ACT Health is the public health department in the Australian Capital Territory. We're responsible for stewardship of the public health system, responding to public health issues such as COVID-19 or communicable diseases, and all the ICT services across all the hospitals in the ACT. As the Chief Information Officer for ACT Health, really my role is to see how we use technology across the public health system. How do we ensure that technology actually helps clinicians provide better care in our hospitals? How do we ensure it works for our community-based staff? Also, how does it work for patients and citizens? How can we ensure that it's meeting the needs of our clinicians on the wards? How can we ensure it's meeting the needs of our patients? And also providing appropriate services to citizens and government. We've bought over 2,500 of the Spectralink Versity handsets, and we've really found them a very versatile device. Different mix of 3G, 4G, Wi-Fi, some with scanners, some without, really to meet all of our different needs, whether it's role-based, issued to an individual officer, to ensure it meets the full range of communication needs across the territory. Before we bought these devices, we went through a fairly long and involved tender process to look at what was out there and what was available. When we started the procurement for these devices, we looked at consumer-grade devices, we looked at professional-grade devices that worked at enterprise level. Very quickly we worked out that consumer-grade devices simply don't work in a healthcare setting. What we found going through the procurement process was that the Spectralink Versity was head and shoulders above any of the other competition in this space. Before we had the Spectralink Versity units, it really was like seeing our staff like tradesmen. They'd walk around with a tool belt full of half a dozen different devices, whether it was a pager, a mobile phone, another Wi-Fi based phone, and various other communication tools such as two-way radios. Going to a single device really has made it much easier for those staff members. They carry one device that does everything they need and is simple and easy to use.
We currently use the Spectralink Versity for recording the information about the administering of the COVID vaccines. I think the fact that it is completely and utterly waterproof, I know as part of the procurement process that the devices were put into bedpans full of water and dropped from high ladders to test out how they survived. They are very durable and something that we relied very heavily on as part of the procurement of them. The clinicians can tap on their cards onto the device and it logs them straight on to the information that they need to be able to access. The device won't even turn off. You just take the battery off and replace it and charge the one you've just taken off. They're very excited about that because it means that they don't have to stop, wait. They can just go in and swap that over and keep going. The fact that these devices can be very quickly and easily wiped down, it doesn't do any damage to the device and we don't have to worry about whether we're damaging it when we do that. We have Spectralink Versity devices used in our emergency department. When you want to communicate quickly that there is a requirement for someone to come somewhere very quickly to support or provide clinical care in the emergency department, it's really important that you can understand and be able to action that information very quickly. We have also these cases where our ICU and ED staff who are wearing full PPE use the devices to be able to communicate and not have to don off and on the PPE too often.
With over 2,000 devices, it's been important for us to have a platform which we can provision quickly Spectralink handsets to our clinicians and to our operational spaces. We've used a mobile management platform to deploy our handsets. Our team who manage the devices and the deployment of the devices use the AMI platform provided by Spectralink.
In the case of ACT Health, they approached me when they were looking for a duress solution, and this enabled me to offer the use case of duress and man down for ACT Health.
This is one of the things I'm most excited about is the future of what we'll be able to do with the Spectralink Versity devices. When we go live with the digital health record in November this year, we'll be rolling them out to every nurse and midwife who is on shift at any time across the entire territory.
What we're now looking at is how do we expand that across the public health system, but also how do we move into the community more? We're moving more and more of our services and our staff into the community. How can we take these same solutions that we're using in wards now and for a small number of staff in the community and expand that across our entire workforce across the ACT?